Jordan, and I will be presenting on the public health nurse's role in disasters. Today I'm presenting for Jed, Jessica, and Ellie, and myself. This is our presentation. So we presented on a disaster scenario that was about a hurricane aftermath in South America. There was a hurricane that devastated a small island nation, and it destroyed a lot of infrastructure in the area. It caused severe flooding that increased mosquito breeding grounds, and just the amount of mosquitoes that were in the area. And so that caused an increase in malaria, West Nile, and Zika cases. And there were some indigenous communities that were disproportionately affected due to limited access of care in the areas that they were living. So during this disaster, we have some nursing priorities just in disaster responses in general. First, our main priority is to ensure safety, triage, and rapid assessment for everyone involved. We also want to monitor and manage communicable diseases. Both of these steps just have to do with the safety and the patterns that we're seeing in the cases. And so we just want to protect our people and the patients that we see. We want to give them the best care possible. And then also we want to provide a lot of education based on these diseases just because there is a way to prevent these, and if there is a natural disaster, we actually want to react to it and educate people so that these cases do not rise as much. We also want to support indigenous communities with culturally sensitive care just because they are a population that gets a lot of effect from these disasters and from these outbreaks and diseases. And then, of course, in any other situation and this one, we want to coordinate with interdisciplinary disaster teams to create safe resources for individuals and get them the care that they need. So part of the epidemiological profile of this case, the cases are increased because of floods, not directly because of floods, but they cause an increase in mosquitoes in the area, and those mosquitoes carry a vector-borne disease. It can be malaria, Zika virus, West Nile virus. For malaria, we see a lot of fevers, anemia, and neurological complications. For Zika virus, we see microcephaly, rash, and joint pain. And then West Nile, people can be asymptomatic, but in severe cases, we do see neurodeficits. As mentioned earlier, indigenous groups can face a higher disease burden. This can be because of where they live or just the way that their lifestyle is ran, and the way that they're comfortable living their life can sometimes predispose them to a case like this. So there are multiple resources on the local, national, and global levels. For local, we want to address community clinics and indigenous leaders. These are the people on the ground that can do the most to do outreach and treat the people needed. And then national, there is a Ministry of Health emergency teams, and these can go to the areas and help out as well. Global, we have the World Health Organization, the Center for Disease Control, PAHO, which is Pan American Health Organization, and Red Cross. All of these have the research and resources available to help in natural disasters. And then we have NGOs, which are non-governmental organizations, and they offer shelters, vector control, and clean water. And these are resources that we can also use in natural disaster cases, specifically with the mosquito outbreaks. Some ethical and cultural considerations during this time for the indigenous populations and any other population that's involved in this natural disaster. We want to respect their spiritual practices and traditional healing. What that means is we just want to make sure that we're not making choices for them. We're giving them the choices, and we're catering their care to what they need and their priorities and their values and morals. Then we also want to promote cultural humility. Same thing, we want to respect their boundaries and their morals. And then we want to build trust with them, that we want to help them. We are there to treat them and make them feel better. We want to ensure equitable access to care and resources. This is an important one for those indigenous communities that are maybe more off the main roads and harder to access. We want to make sure that we have teams that can get out there so that they can treat the people that need help. And then we also want to address communication barriers and make sure that we get informed consent still. If we can't communicate in the same language or find a way to communicate with other populations, we would struggle to actually treat them and help them with their needs. So for disaster and planning relief, as cases are populated, so we can go to those areas and help more. We also want to teach on mosquito protection. A lot of these cases can be reduced if people are accurately protecting themselves against these insects. So we want to educate on how to prevent it or measures they can take to reduce their level of sickness if they do get the disease. We also want to coordinate and triage plan. If there are individuals that get this disease or multiple of these diseases, we want to be able to treat them efficiently and accurately. We also want to advocate for historically marginalized communities. In the past, we've seen maybe more Indigenous people are affected. We've also seen that history paints a pretty good picture of how these disease processes work when there are natural disasters. So we want to study that information and make sure that we use that information to be more prepared for next time. There's also evaluations of community outcomes that nurses need to do. After the fact, we need to assess, did the right people get treated accurately? How did we respond to the natural disaster? And how do we respond to these cases to help people? So the nursing process, again, in population health in general, and in this case, we want to assess risk factors, disease clusters. If there's any cases where these diseases are more popular, we want to target those areas. We also want to diagnose what is their infection risk, what kind of disease process do they have, and then do they have access to the healthcare that they need if they do get sick. The next thing to consider is planning. We want to control the vector. So in this case, the mosquitoes, we want to keep our patients safe, but then we also need to figure out how to reduce possible cases. Then we want to adapt our education and our communication to the right culture that we are around, the right language that would help them actually learn. We want to implement our outreach plans and treatment and prevention measures, prevention before it occurs, and even while it's occurring, just to keep less people from getting the disease process. And then we want to do the outreach and treatment as cases are coming in to make sure that we keep people as healthy as possible. After that, we want to evaluate the infection trends. We want to see how things are trending, if our care or our outreach or prevention has been working. And then we want community feedback as well as how those interventions went. Additional considerations for this process, we want to assess mental health and psychosocial needs. We can see a lot of increased anxiety, depression, and trauma responses after disasters just due to people losing their homes and community structure loss. A lot of this can add a lot of stress to people's lives, and so we want to cater to their mental health and psychosocial needs as well as their physical needs during this time, because this can cause a lot of fright and challenges for people as they get back into the workplace after a natural disaster. We also want to help Indigenous communities just because they may rely on traditional healing and community rituals. So we want to integrate those as much as we can while also treating a person and helping them physiologically get better. And then nurses also are responsible to provide trauma-informed, culturally grounded support, which is, again, we need to respect boundaries, morals, and values, but we also need to treat so that we keep a person healthy and safe. Some other additional considerations, there can be some long-term recovery and vector control associated with these disease processes. So minimizing standing water, we want to do surveillance on the illnesses that are continuing to populate. We want to watch the patterns and just control the vector and watch for recovery and how the population recovers after the natural disaster related to this disease. We want to rebuild infrastructure and prioritize clean water and sanitation just because the mosquitoes tend to harbor in areas where things are not so sanitary, so we want to make sure that we keep things clean and the mosquitoes away for future reference. And then we also want to educate on how they can minimize disease control or how they can minimize their risk of getting this disease process. A case where this has actually happened was in Hurricane Gian. Not sure I'm pronouncing that right, but it happened in 2004 in Haiti. This was a hurricane. It caused severe flooding, destruction of buildings, and then displaced hundreds of individuals from their homes. So it caused a lot of people to lose their safe space that was sometimes blocked from mosquitoes, so they became more susceptible to cases of mosquito-borne illness, specifically West Nile and malaria in this case. During this time, we saw some beneficial actions from healthcare professionals and researchers. We did see that epidemiological surveillance initiatives began pretty quickly on trying to notice patterns and watching the incidence and prevalence of the issues, try and notice pockets or where the mosquitoes were coming from, or just find patterns in this diagnosis. And then they also had a pretty rapid identification of the mosquito-borne illness, and that helped with treatment and to improve positive outcomes. There were some detrimental actions or things that should be changed for the future. relating to the response to storm damage and prolonged exposure. This is something that public health nurses and public health researchers and just everyone involved in public health can change this process. Individuals were not able to move back into some of their homes due to damage, and there was infrastructures and buildings that were damaged, and that caused prolonged exposure and more people to be out of their homes and in areas where they were exposed to more mosquitoes. So something that needs to change is them being able to get to spaces where they can be a little more separated from mosquitoes in homes or hotels or whatever the community has available for housing. There was also some healthcare delivery difficulties. This could be due to the flooding, that certain nurses or healthcare professionals could not reach certain areas due to the flooding and blockages. So in these cases, we want to look for a way to think outside the box and get people resources or get people seen if we are concerned that they have come down with one of these diseases. And then there were also fewer resources available to those communities that were maybe off the beaten path and were harder to reach. So for future plan, kind of going off of these issues that we saw in the past, research proves that the relevance of these mosquito-borne illnesses still occurs. And so we can use history and the patterns that we saw through history to know how to treat people in the future. We can look at vector control and minimizing the amount of mosquitoes that are in the area, but then also having a better public health resiliency. And that can look like building buildings faster, having an emergency disaster plan in place for people to go if they've been removed from their house for safety reasons, just making sure that people stay out of areas where they would be more likely to get these cases. That all goes into emergency planning and preparedness and finding resources that will be available if accessibility is a challenge, if housing is a challenge, just to minimize the cases from occurring again. All right, these are some